Coleman. I'm a Miami-Dade respiratory therapy student, and I'm here to demonstrate intensive spirometry. But before I do, I'm going to tell you what intensive spirometry is, the indications, contraindications, and hazards. The intensive spirometry is a lung expansion technique used to help patients take slow, deep breaths. Indications for intensive spirometry are patients who had surgery, COPD patients who had surgery, upper abdominal and thoracic pain, upper abdominal and thoracic surgery, spinal cord injury, abdominal binders, restrictive lung deficit, atelectasis, and prolonged bed rest. The contraindications for intensive spirometry is patients who are instructed but aren't able to perform an SMI maneuver, patients who lack cooperation, and patients who are unable to take deep breaths due to a vital capacity less than 10 milliliters per kilogram. Hazards include patients who were taught the wrong technique, hyperventilation, hypoxemia, exacerbation of bronchospasm, fatigue, and patients who lack proper pain control after surgery. I start my demonstration with the MD orders. I verify the MD orders. I check to make sure are there any indications or contraindications. I gather the equipment, which is the mouthpiece and the intensive spirometry device. And now I'm going to wash my hands, and I'm going to don my PPE. And I'm going to wash my hands for 15 seconds. I introduce myself to the patient, and I check patient identifiers. Hello, my name is Armenta. I'm a respiratory therapy student. Your name is?
Doris St. Louis.
And your date of birth?
May 13, 19.
I check the patient's wristband for the medical records number to make sure I'm doing the right patient. Next, I check my patient's vital signs and breath sounds. Then I'm going to teach my patient on how to use the intensive spirometry device. Extend the tube so the patient can see their progress. This is where your target volume is, which is 2650. I got that by your height and your age. What you're going to do is you're going to breathe in and out on your own. And when you feel comfortable, you're going to inhale. Seal your lips around the mouthpiece, inhale, and the bar is going to rise. But you have to make sure to keep the yellow piece in the happy face, okay?
Okay.
Once you reach your peak, when you inhale, you're going to hold your breath for 5 to 10 seconds, okay?
Okay.
Good job, good job. The patient wasn't able to reach her target volume at first, but you're going to do this every hour for 6 to 10 times. Then by then you should be able to reach your target volume.
Okay.
I'm going to place this at your bedside in reach so you can continue to practice, okay? I'm going to reassess my patient's vital signs and breath sounds. Are you okay? Do you need anything from the nurse?
No, thank you.
I checked if my patient is okay, and I'm going to remove my PPE. Wash my hands again for 15 seconds. I'm going to chart down my findings, and that is it.